Right after I had the Y lift and I looked in the mirror, I couldn't believe what I saw. The sagging, everything was gone. It was like lifted.
So why not you? For a younger look, you can now have Y-Lift, the revolutionary non-surgical facelift, absolutely free of incisions and scars.
I have cheeks, I have a chin, I have a jaw now. I never had those things, ever.
In the hands of Y-Lift doctors and specialists, your cheekbones and jawline can be accentuated without incisions or invasive procedures.
It gives you your self-esteem back. There was no downtime. And that night, I went out to dinner.
What nature didn't do for me, the Y-Lift did.
Have the younger, glamorous look you crave, but with no scars, no incisions, no general anesthesia, no surgery. Call today and we'll put you in touch with a Y-Lift cosmetic physician.
Why not you?
Welcome to Accent Your Beauty. I'm Jackie Kallen, and I'm with Dr. Mark Berkowitz. And we just saw a V-lift, or is it a Y-lift?
It's a Y-lift.
A Y-lift. I knew it was near the end of the alphabet. Tell me about a Y-lift, because it looks great. It's something that I think I'd be interested in.
So the Y-lift is pretty amazing. You know, people, while they do enjoy the differences that surgery can make, are trying to get away from all the downtime that surgery can have. It doesn't always have, but can have. And they want results today. And sometimes with surgery, results don't come about for a few days or a few weeks' time.
Or a few months.
Or a few months' time as well. So the Y-lift was invented by a Dr. Trokel in New York, and it's just a fascinating procedure. I'd like to show you a little bit of the history of it. Let's go to the first slide. So, as this says, this is the main thing about it. There are no incisions at all. There is no general anesthesia. There's no downtime and instant results. And that's what people are looking for.
So this is like the lunchtime facelift.
You could do this at lunchtime. When we have people come in and they're doing it at lunchtime, some people go back to work, some people take the rest of the day off, but you don't have to.
How long does it take?
So depending on what we're doing, and we can customize it, so we can just work on the brow, or just work on the cheek, or just work on the chin, or just work on the jawline. It's anywhere between 10 or 15 minutes to up to an hour's time. So the most is 1 full hour. Let's go to the next slide. So it's a contouring procedure. So when other doctors use filler, they're kind of just filling, but they're not really changing structure. This is a procedure that changes structure, and it's really so revolutionary that when it was on Dr. Oz's show, he called it the 30-minute facelift, but on the doctors, they called it the wow lift after seeing the difference. And it lasts between 1 to 3 years time.
That's
so you're
great.
giving 15 minutes to an hour to get a change that can last 1 to 3 years, and it can be used both in men as well as women. Let's go to the next slide. So when we're youthful, our face has more of a Y look. So if you look at the brow down to the nose. But over time, that Y begins to widen. And so what we're trying to do is put back the contours and give back that natural Y. Some people think the Y is for Jan, because Jan Trokel invented it, but it's for the shape of the face.
I thought it was for youth.
For youth, we can call it whatever makes you happy, that Y can stand for. Next slide, please. So the arms begin to spread and the face begins to deflate, and that's what causes that Y to spread. It's a loss of volume. But more than the loss of volume, what people don't realize is that what ends up happening is, yes, there's a loss of volume within the face, but the whole bony structure of the skull changes as well. So if you just put back the volume, but you don't change the underlying structure, you're not getting the full benefit. And so the Y lift is a structural lift as well. Let's go to the next slide, please. And you can see here again how the Y changes, and we can go to the next slide. So the facelift, which is the quintessential procedure to rejuvenate, well, if you think of that balloon losing volume, so it loses volume, and then what does a facelift do? A facelift tightens the skin. Well, if we had this balloon and we just tightened after the lost volume and we didn't put back the volume, we'd have this surgical facelift balloon. It's just a smaller balloon. You're not getting back everything that you need. So you have to put back the volume. And if you put back the volume, that for many people is 95% of the battle, because you don't necessarily have to tighten the skin, because if that volume is back, the skin redrapes itself.
So for some people, this might actually be better alternative than a surgical facelift.
Than a surgical facelift. And for some people, the combination works beautifully, so volume along with tightening. But for many people, they just need that volume back. And so, with volume, people think, well, how much volume do I need? What is in a syringe? So a syringe is 1 cc. So 1 cc of filler is 1/5 of a teaspoon. And so if you put back 5 syringes, you're putting back 1 teaspoon of volume. Well, we lose from age 30 on about 1/5 of a teaspoon. So a decade, we need about 2 teaspoons. And if putting back volume properly, you're putting back 2 to 3 teaspoons of volume, you can rejuvenate the majority of people who are over 30, 40, 50, 60 years old just by putting in the proper amount of volume back in for them.
So for some people, it's easier, quicker, less downtime, actually no downtime.
No downtime.
Should we talk cost, or is that coming later?
No, we can talk costs. So, if you're doing a Y lift where we're treating from basically the jawline all the way up to the brow, it can run somewhere between $5,000 and $7,500. If we're doing, just a partial area, we're just doing around the cheek area, it can run, $1,500 to $3,000. So it really depends on what we're trying to accomplish for you.
Well, you as the expert, you can look at a patient and determine how much or how little they need, right?
The answer is definitely yes, but I have to take into account, number one, their finances. Number two, what are they looking to accomplish? And, some people will come in and I just, doctor, I just want 1 syringe. And it's like, well, is it worthwhile to do 1 syringe for you? Unless you're, 18, 25 years old and we're just putting a syringe to refill your lips, most people, 1 syringe is not enough to make a change.
So the Y lift is injections?
It is injections with a very special instrument that is used to place the filler not just underneath the skin, but structurally along the bony structure of the skull as well, without any discomfort.
Without any discomfort?
Without any discomfort during the procedure.
So this is less, I won't say painful, but less uncomfortable than, let's say, Botox or Juvederm or the other
So
injectables.
I would say it's equivalent to getting filler, but with more benefit because of the specialized placement and because of this special instrument.
So obviously, assuming that money is not an object and someone comes to you, you're still only going to give them what they need. You're not going to give them everything just to get the money. You're going to say what they need.
Education is one of the biggest parts of my practice, and my name is on everyone's face. And so when someone comes in, we look at, again, what they're trying to accomplish, what their finances are, and it makes no sense for me to put in too little filler unless they understand what the ramifications are of a smaller degree of filler, and never makes sense to put too much filler. I can always go back and add more.
And that's, I think, one of the issues I have with a lot of other cosmetic surgeons is they overfill. And the patient asks for it not knowing that they're going to have to live with that for a while.
They have to live with it for a while, and so you're much better off being conservative, making a change that is something that you look at and say, wow, you know what? This is great. It looks natural. And you know that you can always come back another day and we can optimize things.
Well, I think that I know women who do it that way. They go in, they get a certain amount of filler, they live with it for a few days or a week. And then if they think they need a little more here, a little more there, they go back. And isn't that a smarter way to do it?
I think it's a smart way, as long as you don't start with much too much as far as too little. So if you look at it and you say, you know what, I know you're telling me I need 3 or 4 or 5 syringes, I just want one. The problem is when you place one, if you don't see the results, somebody can end up being very unhappy saying, I put filler in and I'm not seeing any change at all. And so you have to be careful that you're not going the opposite and doing, too little for them.
Let's go back to this why, because I'm fascinated by this. How many injections do you think it takes to do a whole face? I mean, obviously there's a certain amount around the eyes, certain amount around the cheeks, certain number of injected spots here.
So when doing the Y lift, we use a very special instrument to place the filler. And
is it like a cannula?
It's like a cannula. And so with that, you're making usually insertion points at prominent areas that are going to be used for multiple places. So let's say a tiny insertion in the area here, so small, in fact, there's no stitches in regard to this at all. So from one area, I can fill the temples, I can fill underneath the brow, I can fill into the cheek.
Is it the same size hole that there would be from any other
For almost any
injectable?
other injection, that's correct.
What about bruising?
So again, because this instrument, which is like a cannula, is used, the chance of bruising is greatly reduced. Also, the fillers have numbing medicine in them and a little bit of epinephrine, which brings down the blood vessel, so it's less likely to bleed if you were to hit a blood vessel. But because these are not sharp instruments, the chance of swelling on black and blues is greatly reduced. It doesn't mean it's unheard of to get a little bit of swelling, but most people are makeup ready within 24 hours. And I would say the majority of my patients either go back to work the next day or the following day.
Wow. Yeah. That's amazing. So how many holes typically would you make if someone did their whole face?
So if they did their whole face, there's usually on each side probably 3 key areas that I work from in order to place filler throughout the entire face.
And then once you inject the filler, do you manipulate it with your hands to spread it?
So I do some massage to the area, but I don't necessarily push and mush.
Right. I don't like the push and mush.
I don't necessarily push and mush. It's really placement that is ideal for that particular person, that we look at their own anatomy, and we're placing in small aliquots, small amounts, where it needs to be placed. I'm not placing a bolus, a large amount, and then using my thumb to spread the filler. I know exactly where it needs to be placed, and I'm placing it there.
Now, what substance? Is it the typical Juvederm and those kind of fillers?
So the Y lift is used with hyaluronic acid fillers. So the fillers that are most used with it are Voluma, which is the #1 filler FDA approved for the cheeks, and Juvederm, which is the #1 filler in the world.
So is Restylane kind of out of fashion now?
No, Restylane is not out of fashion. It's like Coke, Pepsi, and Diet Coke.
Right, they're all different variations.
And so, doctors will have their favorites, and it's possible to do a procedure like the Y lift with Restylane, with Versa, even with a long-term filler like Bellafill. But the Y lift,
you use Volbella in some of those?
You could use Volbella too, but the Y lift in its purest form is done with Allergan products, so the Juvederm line and Voluma being part of that.
So the Y concept is the utensil you're using, not the filler.
It is the concept of placing filler structurally, not just underneath the skin, so that bony loss that occurs as we mature in the skull, we're replacing it with filler by placing the filler deep too.
Well, doesn't that hurt more that you're going in deeper?
No, because we know where to place it, and we know how to freeze simultaneously as well. And if somebody needs to, in my office, I have a special machine called Pronox, and what that is, it's actually nitrous oxide, that depending on where we're placing, you can breathe in nitrous oxide. It's very rare we need to use it with filler, but some people just need to get over the edge. There's a great way to freeze areas. Ice.
Now do numb it first?
We have numbing that can be placed as far as a numbing cream. We have ice that we've made into special forms that you can hold onto your face that numb the area beautifully as well.
See, that seems like it would work really well. If you freeze it there long enough, you're not going to feel anything.
You don't
it's so
feel it.
numb.
Plus, I also use a special tool to vibrate as I'm injecting. So the vibration occurs.
And that deflects the pain.
Deflects the pain. It throws off what you're feeling. And so you're really thinking about what's this vibration as the injection's occurring. And so the majority of people are super comfortable throughout.
Now, how new is this technique? Because this is the first time I've heard of it.
So the Y-Lift's been around for over 5 years' time. And there's thousands of patients nationwide who have had the Y-Lift. I was the first doctor to bring it to Michigan 3 years ago. And I've treated, hundreds, if not 1,000 patients with this procedure already. And it's pretty amazing. So let's take a look at the next slide as well. So again, this is showing more that structure. So by placing the filler deeper down, you're giving the strength of the muscle to the filler as well by placing it underneath. So it's helping to not only give structure by the bony tissue, but underneath the muscle gives more of a pull as well. Then it can be placed over the muscle too. It depends upon the area that we're trying to change. But by injecting, you can hold the muscle to elevate it as well.
Well, I see here it says the face is then sculpted by hand, which is exactly what I was asking you about, if you do manipulate it.
There is some manipulation, but again, it's not just a push and mush. You have to place properly before you do the sculpting with it.
Well, this sounds like a great alternative to just plain spot injecting. I mean, this is like a plan where you're contouring the whole face.
My favorite way is somebody who, again, yes, comes for the entire face, but some people are not ready for it. They look and they want to start small. They just want to go after their cheek. That's what they see. That's what their friends maybe have brought up to them. And so that's where they'll start. Or they'll just start along the jawline. Maybe they've had dental work. And with the dental work, what's happened is they have a collapse centrally on their lower face. And so we may start there. So we can customize it, any way they'd like.
Well, I want to hear more about this. So we're going to take a break. When we come back, we're going to hear more about the Y-Lift.
Perfect.
Advertising your business these days can be challenging. Traditional radio and TV ads are expensive and, frankly, a bit of a crapshoot. Not to mention, the audience for over-the-air material is shrinking as more and more of us demand to see and hear what we want, when we want. Advertising on new radio media is a solution. With our live streaming programs that are also available on demand, your message is always ready when your customers are ready to watch and listen, all for a fraction of what you'd likely have been paying for other ads. NewRadioMedia.com. Call Buzz Van Houten at 248-939-9999 for more information.
I'm Jackie Kallen with Dr. Mark Berkowitz.
We all accumulate so many products.
They probably dry it out if I open the jars.
You can't miss the team member with Medicare.
You're a critical part of the team.
Yeah.
But I don't eat the yolks. That's not really helping them diet, is it?
They're not getting anything out of it. It goes right through.
With these relatively small steps, it becomes a lot easier over time to make major lifestyle changes.
Put your arms out if you want to. Whoa! Nice!
Right after I had the Y-Lift and I looked in the mirror, I couldn't believe what I saw. The sagging, everything was gone. It was like lifted.
So why not you? For a younger look, you can now have Y-Lift, the revolutionary non-surgical facelift, absolutely free of incisions and scars.
I have cheeks. I have a chin. I have a jaw now. I never had those things, ever.
In the hands of Y-Lift doctors and specialists, your cheekbones and jawline can be accentuated without incisions or invasive procedures.
It gives you your self-esteem back. There was no downtime. And that night, I went out to dinner.
What nature didn't do for me, the Y-Lift did.
Have the younger, glamorous look you crave, but with no scars, no incisions, no general anesthesia, no surgery. Call today and we'll put you in touch with a Y-Lift cosmetic physician.
Why not you?
I'm so excited about this Y lift. I want to hear more and more about it. Actually, during the break, I got a text from a friend saying, sign me up. So I think this is going to be a real popular technique and procedure. Let's talk more.
Let's talk more. Let's see in the next slide. So we're going to take a look now at people who have gone through the Y lift and the results that they've achieved. And by looking at different people, you're able to see people who may look like your friends, people you may recognize, and give you an idea of the changes we can make. So here we look at this lady, and number one, it's opened up her eyes. She's got a little bit of a lift in the brow, but mostly where you're seeing it is the lower face for her. The cheek has been filled for her. She now has a better jawline. She was getting jowling before, and the jowling has gone down dramatically. That indentation between her chin and the jowls is gone, and she has a youthful contour to the lower lid by the lower jawline. If you look at her lip area as well, we've smoothed out the upper lip area for her too. Looking at the marionette area, that area is smoothed out and just gives a better glow for her overall looking at her skin.
And that's 3 weeks after.
That's 3 weeks after. And we'll show some people that are just a few days after too.
Yeah, I'd like to see that.
So let's look at the next slide. So here's the same lady, and again, looking at different views helps us to see, since they're not here to show us in 3-dimension. But I think this view is even nicer.
Especially of the jawline.
Look at that jawline, right? So
Beautiful.
She did not have a facelift, and in the past, to get this kind of change in the jawline, somebody would need to have a facelift. But no facelift at all. Look at the rejuvenation, lifting that youthful cheek now. Her cheek was flat before.
Right.
Looked sad.
Saggy, yeah.
Right? And so now we've lifted, revolumized, and it's just made such a beautiful change. You can't help but smile.
She looks beautiful.
Next slide. Again, a lady you'd see in the supermarket, Trader Joe's, walking by you, and think, okay, nice looking lady, but when you add the volume back that she's lost, she now looks youthful.
More refreshed.
More refreshed. And the beauty, what I really like about this slide is the one before we had her smiling after, but she couldn't help but smile. Here, she has the same facial expression, but she just looks younger, more vibrant.
Oh, much more vibrant. And everything looks lifted this way.
Yeah.
It doesn't look as hanging. It looks more up.
And just even like if you look at her cheeks, you know, the underneath the cheek where that division is, it's more of an athletic look to her face as well, and just has, you know, rejuvenated, and you know, this changes lives for people.
Takes away a lot of the gaunt look that people get as they get older, that hollowness.
That hollowness. And so just giving back a little bit of volume makes a big change. Next slide, please. So again, it's also nice to see different ethnicities.
I love that. So you can see.
So you can see she can go about her normal business.
Not a mark on her.
Not a mark on her. You know, people will look at her and just say, did you have your hair done? Is her makeup different? Was she on vacation last week?
Right. Look at the softness in the nasolabial folds.
Nasolabial fold.
Much nicer.
You know, before her nasolabial fold was coming down, and you could see it, but it also what happened was the cheek, it's almost as if there was a log within the cheek, and just because she lost volume above that area.
Well, that little apple area was gone. Now you
and the high point of her cheek was sitting low underneath her nose.
Correct. It was
and that's not a youthful cheek. And so you give her back the look of youth, the fountain of youth with this Y lift. The Y is maybe for youth, for fountain of youth.
That's what I said. It's for youth, because look at it.
And just beautiful. And again, she didn't have much jowling, but just placing a little bit within the jawline.
Just like Natalie Wood.
And again,
beautiful girl.
Just look how the flash hits off her skin. You know, we love to look at babies because of the volume that's there and just the way their skin resonates from
well, how did it affect the texture? Because her skin looks smoother, more velvety.
Right. It's an illusion because of the fact that that volume is back to that
So
area.
the light reflects
and
differently
light reflects
off the
differently.
surface of the skin.
Right, and so that makes us,
Beautiful.
this person on the right, we want to go over to talk to her. Next picture. So again, looking at the side view. So before, when we looked at the side or the lateral view, we said didn't look like she had much jowling. But when you show somebody their side view,
Oh, I know.
nobody wants to look
It's
at their side view.
nobody's favorite view above a certain age.
Right. Nobody wants to look at their side view. But look at how
That's remarkable.
it's sculpted, and you have that nice step down from the jawline into the neck. Before, her neck was kind of running into her jawline. And so it's just, and look how the light reflects on her jawline and on her cheek afterwards.
It's amazing that it's the next day.
Next day.
Wow.
Next day. So you don't have to wait. Now, that's it. If you're getting married the next day, your daughter's getting married the next day, it's not smart necessarily to run into...
No, you've got to give yourself a week at least.
At least a week.
Right.
At least a week. Next slide, please.
Oh, that's pretty.
So
that's
again,
a nice result.
Beautiful result. Again, no makeup. And what we're looking at is just the way light now reflects due to the change in contours.
The cheeks. The cheeks are so much fuller, higher, more defined.
And people are nervous. They're saying, I don't want a fat face. I don't want a fat... It's not a fat face. We have, listen, we do this on all ethnicities. So we have Korean ladies whose faces are more square, but when you place filler properly, it thins down the face.
So they get more of an angular look,
They get more
not
of an angular
that
look.
moon face look.
And so it's not going to give you a fat face. It's the same thing with women in the gym. They're all worried, well, am I going to bulk up? Well, if you want to bulk up, but if it's done properly, you don't have to bulk up. You don't have to bulk up your face either. You can give a nice youthful change.
And that's also a day later.
A day later, look at the jawline for her
Beautiful.
too. And again, nice looking lady before, but that change just is dramatic with, no downtime, not going to the operating room, no discomfort, going about your normal business. Next slide. So
Wow.
look at the lower face. Remember what I said again,
That's
people...
amazing. That difference
Yeah.
is humongous.
So people who their lower face changes, and usually these are people who have had dental work when they're so young,
okay.
and they've had major dental work, and then what ends up happening is there's a collapse of the surrounding area.
Does that happen with smokers as well? People
Happens
who
with
smoke
smokers
a
as
lot,
well.
they get that same
Right, but
kind of a
usually
look.
but usually not along the jawline as much, but here, putting back the volume. Would you say after she has a fat face? No.
No, but that's a remarkable difference for and that's 2 days
2 days
after.
later.
Unbelievable.
2
I'm
days.
impressed. This is my favorite because looking from the nose down, it's like two different people.
And again, just look at her cheek area. Look at her lower lid area. Look how elongated that lower lid area is because the cheek has fallen. Give back that volume, and just it's amazing the look of youth.
Even
after.
her nose looks perkier and
Right, and that's without placing volume within the nose. And we actually do
But-
non-surgical rhinoplasties as
but
well.
I can see the difference.
But you're reframing the nose. You're
Exactly.
reframing the eyes. You're
Beautiful.
reframing the lips.
That's very dramatic.
And so when you reframe the face with proper amounts of filler, it's life-changing in a good way. Next slide, please. Do we have another slide?
Oh, there we go.
There we go. So again, beautiful lady. Just add back a little bit of volume. Give a little bit of a raise even to her brow by doing that. Along the jawline, into the cheek area. The pictures on the afters are not photoshopped. This is not a filter. This is the filler. And then with the filler, the way light hits off of the area afterwards. And, just a little bit of lipstick and just beautiful
Well,
change.
she's a beautiful girl,
Yeah.
beautiful eyes. But look at the area again from the nose down. it's like magic.
It's magic. It's such a beautiful change that really, we have people in tears and of happiness afterwards.
Oh, I can see why. Now that says 9 weeks after, and I assume it's just because that's the next time she was in and
right. And
able
so
to
we
take the
want to be
picture.
able to show that it's not something that is just swelling.
Right. It's going to still look like
some
that.
people think, oh, she had swelling and that's why she looks so good. Well, there's no swelling 9 weeks later.
Beautiful. Beautiful. Do we have any others, or is that the end of our slides? Let's see. Oh,
so
there
here
we
she
go.
is.
The same girl, but look at the difference in the jawline.
The jawline, but not just the jawline. Now look at her neck too. We've changed the neck by redraping. It's lifted the skin underneath her neck that beforehand she was unhappy that she can grab a little bit of the skin within that area. And so now we've recreated the angle, and you can see the beautiful contours, the OG curve it's called, along the cheek area for her, and just looks beautiful.
That's incredible. I'm so impressed by this. Of all the shows we've done, this is one of my favorites because the results are dazzling.
And what I'll show you in the next segment are some ladies that saw some of these pictures and then came to me, and all three had the procedure done the same day, and I'll show you some of their pictures.
Oh, great. Can't wait to see that. We'll be back in 2 minutes and look at some more pictures. We'll be right back.
Yo, what's up? This is your boy Walter Jones, also known as Zach, the original Black Ranger, and you are geeking out with Geektainment Weekly at New Radio Media. It's market time.
Welcome back to Who's Got Chutzpah. I'm your host, Rabbi Tzvi Jacobson. Andy, are you ready? Andy, what holiday is this associated with?
Oh boy, Sukkot?
I'm sorry, that's not the answer we were looking for. Whitney, for the win. Can you tell us which holiday is this?
I know. Shavuot.
No, I'm sorry. I've got the answer. Ta-da!
What?
My show, Let's Talk Torah, where we talk Torah, holidays, faith, and all the things that help us live our life. That's Let's Talk Torah, Thursdays at 3 p.m. on NewRadioMedia.com.
That's pretty good.
Right after I had the Y lift and I looked in the mirror, I couldn't believe what I saw. The sagging, everything was gone. It was like lifted.
So why not you? For a younger look, you can now have Y-Lift, the revolutionary non-surgical facelift, absolutely free of incisions and scars.
I have cheeks. I have a chin. I have a jaw now. I never had those things, ever.
In the hands of Y-Lift doctors and specialists, your cheekbones and jawline can be accentuated without incisions or invasive procedures.
It gives you your self-esteem back. There was no downtime. And that night, I went out to dinner.
What nature didn't do for me, the Y-Lift did.
Have the younger, glamorous look you crave, but with no scars, no incisions, no general anesthesia, no surgery. Call today and we'll put you in touch with a Y-Lift cosmetic physician.
Why not you?
We're back talking about the Y-Lift. We decided the Y is either for youthful, or in my opinion, it's for yes, because this is a definite yes. So we have some more pictures?
So when I gave this presentation in the past, what ended up happening was we had one day where 3 friends called up and they said, we all want it. And so I'd like to show
It's fun to do it in groups.
We may have, I'm not sure if their pictures are first, but let's show the first one. So we're going to show some more of the pictures that I had showed them, and then we'll get to that.
Okay.
So here's an older lady. Before we showed people who are more probably in 40s, 50s. This lady's more in 70 plus. And then we've given her volume back. Didn't want to have a facelift. And I think she has a beautiful change. The only thing that I wanted or would like to do for her that she didn't want is I'd like to place filler in her upper eyelids. And people are not aware that you can do that.
In your upper eyelids?
Upper eyelids. Because if you look, her upper eyelids, you're seeing the bone of the brow. Then her lid is long, but there's
I see.
Really,
so it kind of like
there's no platform, so she's
sort of
lost
a little
that
recess area there.
And that basically is far from youthful when you see that.
Correct.
That it's atrophy, a loss of fatty tissue, and so you can actually use Juvederm within that area and fill in the upper eyelid, and it just
Really?
gives a beautiful youthful look. You also can use your own body fat as well.
Never heard of that, but it sounds like it makes sense, especially because the more hollow the eye is, the older you look.
The older you look. And again, this is somebody, again, next day, ready to go out, do her Black Friday and Cyber Monday
Wow.
shopping. Next slide. So the next are the three ladies who came in and right afterwards. So now if you look at her before, what I'm drawn to on her is her neck.
Me too.
Okay.
That's the first thing I
She
definitely
has
noticed.
such a heavy neck, and so she did not want to have surgery. This is somebody that normally what I would offer her is a procedure with 3 tiny incisions, one underneath the chin and one by each ear. I would then use a laser underneath to melt the fatty tissue. I would do liposuction to the neck and the jawline, and then I would use the laser. I would turn it so that the laser would tighten the skin, and I would use the laser to tighten the muscle underneath as well. But for her, we didn't do that. We placed volume into her face, redraped her skin to her upper face, and by doing that, that changed her neckline as well. And she, I mean, it's just dramatic.
It shortened her whole face.
It changes
gave
the
her
entire
more
face.
symmetry.
Right. You make things more symmetrical, you reframe her face, and it's just a beautiful change. And again, we're showing 2 weeks later.
But look at the difference in the cheeks. She had no cheeks.
It was
the first
just
picture was
elongated
straight.
face.
Now, maybe it's because of the cheeks and the decreased fat in the neck that her face looks shorter and more symmetric.
More symmetrical and just
Beautiful.
looks so beautiful. And you know, again, changing underneath her neck area by doing everything above the chin. It's amazing.
It is. That's an incredible result right there. I love that.
Next picture. So her friend came in, beautiful woman, and again, has volume. She was so nervous that she'd have a fat face afterwards. And she needed volume to, again, help her lower lid area, because the lower lid area, when I look at her lower lid, I would say she needs eyelid surgery to help reduce the fatty tissue that's there. And the way I do that is using a laser, no skin incision at all, no stitches, no scalpel. I would use the laser to contour that fatty tissue, then the same laser on the surrounding skin. But that would give her a week and a half, 10 days of downtime before she'd be in makeup. Didn't have it. Didn't have that time.
Plus, that's more expensive and it involves anesthetics, correct?
It involves anesthesia,
So
and it's a procedure that's done in the operating room with a board-certified anesthesiologist to make you comfortable. Didn't want to have it, and so by placing that volume back, we reframe the lower lid for her.
Big difference.
Reframe the lower lid. We're reframing the lower face as well by placing in the cheek, because the cheek is the foundation for the lower lid. It's the foundation for the lower face as well. It lifts the jawline and just smooths out, just beautiful, the change. And again, 2 weeks out, and
That took 5 to 10 years off her face.
yeah, just looks beautiful.
Turn the clock back.
Beautiful. Next slide, please. So, again, another friend who came in, we see her picture beforehand, and beautiful woman, and you know, just needing a little bit of volume to give that youthful look back, and you know, looks years younger just by giving that volume back.
How old approximately is that woman? Do you know?
So approximately in her 40s, late 40s.
Okay.
Yeah.
Beautiful. You can see how happy she is.
Yeah, and just makes it. And so all three of them were just so happy. Let's go to the next slide. that they took a nice picture with me.
Oh, that's beautiful.
So-
Look at them.
So here they are, again, beforehand, all three of them, loss of volume, from, late 30s to early 50s, and just making a beautiful change without having surgery, that they can go out literally the next day, go back to work.
The one in the middle, I'm especially impressed with because she looks like a completely new, refreshed person. The other girls look beautiful, more youthful, but they still look like themselves. The one in the middle, I mean,
It's changed her face
beautiful.
for the better.
It really is a beautiful change.
Yeah. So I mean, this is a procedure that, again, we're using the top fillers, Voluma and Juvederm. They're the #1 fillers that are out there. It's very cost effective. There is no anesthesia. There is no incisions. There's something that if you look at it and you just say, how can I afford it? How can I do it? You can do it. Basically.
Don't forget,
we have
you do
0%.
financing.
My staff is amazing to help you find financing.
That's a beautiful
We have
aspect of
0%
it.
financing. We do this both in the Sterling Heights office on Delco Boulevard, as well as in West Bloomfield on Orchard Lake. And again, it's done in an environment that you're feeling comfortable. You're giving 1 hour of your time, and you're getting between 1 and 3 years of time. And that's to say, at 1 year, if you're saying, hey, I'm seeing some changes back, well, maybe we need 1 syringe to get you back to where you were. You don't need to go the whole thing again. Right.
Well, I love the fact that you arrange finances so that people who can't afford to pay it all at one time can pay it out. That's a big plus. And the fact that you have 2 different offices to choose from. So if someone's on the west side, they have an option. If they're on the east side, they have an option.
Plus, we have people who say, people call up, say, I'm in the Sterling Heights office, can I come in now and have them, but I want to do my follow-up in West Bloomfield, because they work one place and live another. And so it just makes it easier for the clientele.
Well, I think the nice part of this is the fact that it's so immediate. You get those results, that instant gratification. You don't have to, like with Thermage or some of the other things that take 6 months to see a result.
And those are great procedures, Thermage and other radio frequency. But, we want to see the results today, make us happy today, because, somebody probably looked in the mirror and they said, my God, I think I'm seeing Mom, or I think I'm seeing Dad.
I think we all see our parents
and they
as
say,
we get older.
Boy, can I turn back the clock? And even better, can I turn it back today? And we can. And we can with, limited downtime, something that is financially viable.
Let me ask you a question. Are there any negative side effects? In any procedure, you can have bruising or swelling.
Yeah.
Those are the typical things that don't usually occur that often.
Even though this is not a surgical procedure, I actually treat this and other fillers as if I'm performing surgery. The reason why is I'm still doing an injection. I'm still making an insertion of the filler. I don't want makeup being put underneath the skin. I don't want bacteria being put onto the area. So there's a chance with any kind of injection of infection. Knock wood, wherever wood is, I've never had anyone have an infection. With filler, some people can get more swelling than others. It's not expected, especially with the hyaluronics, but it's possible to, get more swelling.
And then I imagine that there's an increase in bruising if you are on aspirins or, blood thinners.
If you're on blood thinners, and a lot of the supplements can cause a thinning of the blood too, so you're better off coming off of supplements.
Which are the supplements that can cause that?
There's a lot, but if you think of the ones, especially with G's, garlic, ginkgo biloba, ginger, those are more likely to Garcinia to cause bleeding. But we have a list that we're happy to send you beforehand too.
That's helpful, so that you know what to get off of.
What to go. But again, if it's something that you're on for another problem, you've had something, let's say, called atrial fibrillation, and so you're on a blood thinner for that. We don't want you coming off that without your medical doctor giving their blessing, because These are cosmetic procedures. They're not open heart surgery. They're not brain surgery. They're nothing you have to have done. I know you want them, but your safety is very important.
There's a big difference between wanting and needing.
That's right.
But I think cosmetic surgery is something that women want.
And we can find a procedure for you. If you're on a blood thinner, we can find procedures that are safe for you to be done, even if it's not a filler, that can give you nice results. If some people just can't come off of the medications. And if we can't, there are other things that can be done.
I think another benefit of a procedure like this, or any cosmetic surgery, is that it is a cure, not 100%, but it does help with depression, anxiety, feelings of inadequacy or insecurity.
There are studies proving that.
I know, I've read them.
Especially studies with Botox as well. You know, they found that using Botox, that when people were depressed, now because they can't frown as much, that it increases their overall happiness.
Because they look better, they look happier, people treat them different. When you're looking depressed and you're looking down, people treat you based on that. So when you're looking bright and happy, people respond to that.
We give that smile lift. And so if you can smile at yourself in the mirror, it's going to change your life. It's going to change the way people look at you. It's going to change the way people react to you. And as you say, people, when they're looking at other people, they judge them.
Unfortunately,
it's part of human nature.
It is human nature.
It's part of human nature. And so it's not right, it's not wrong, it's innate in us. And so there are studies proving that when you have cosmetic procedures, it can change the job that you get. It can change the spouse that you get.
100% it changes your relationships because you feel better about yourself. You're more relaxed. You're more open to a relationship because you're not as self-conscious, whether it's a big nose, whether it's wrinkles, whether it's sagging. Those things do have a way of depressing you. So cosmetic surgery is a wonderful way to not only look better, but to feel better about yourself. And when we come back in 2 minutes, we're going to look at some celebrities who we think have had some work done, and we're going to decide what they've had done and did it work or did it backfire on them. We'll be back. Welcome back. This is my favorite segment every week, and that's when we get to look at celebrities and see what they've done. And who do we have today that we can tear apart?
Let's take a look.
Oh,
so this
wow.
is the human Ken doll.
Well, I don't know what to make of him. I mean, he doesn't look real in this picture here at all. Is that what he started out like?
That's what he started out like.
He was a good-looking guy.
Yeah, and so, you know, as far as his brows, his brows were heavy, and so, I mean, this wasn't surgery. That, you know, he thinned out his brow a little bit. His eyes are more open, so it looks as if, number one, he had a little bit of a lift in the eyelid, but not much. The lower lid goes directly into, like, almost looks airbrushed into the cheek area.
It does look airbrushed. I mean, he doesn't look real.
Right, and so, you know, with that, you can see before his lower lid went into almost a line that went into his cheek, and so he had filler within that area itself, and the filler made it that his lip changed and reframed the lip, but he also looks like he put a little bit of filler into the lower lip in order to give it more of a rounded look. And he went from a masculine jawline to more of an effeminate jawline.
Not to judge, but I think he looked so much more handsome in the first picture.
Yeah.
His face was a little fuller, but he demasculated himself. He almost looks like asexual right there, you know?
And I think there are things that could have been done to make him happy that would be in between the two, with still keeping a masculine look, but maybe that's not what he wanted. Maybe he did want...
Well, he does look like a Ken doll because he kind of looks like what he was trying to look like.
So
God bless him, but
hopefully he's happy.
I'd smack him if it was my son. Next.
Next. Michael.
this one, you don't know where to start. But, I mean, how do you go from a young black man to an old white lady? I mean, that's about as dramatic a change as a person can get. And I loved him, and at all of his stages.
Yeah.
But can we start with that nose?
So I think that's where you need to start. So, you know, unfortunately, we don't have the pictures in between, but what happened was his nose was botched again, until the point where there's no cartilage left.
At the end, he used to have tape on it.
Yeah.
Flesh-colored tape to hold it together.
To hold it together, and also to help him breathe.
Oh, my God.
Because the nostrils would be coming together. And so, you know, this is, you know, unfortunate that he had bad surgery. And people think just because it's done in Beverly Hills, California, not Beverly Hills, Michigan, but Beverly Hills, California, that it's got to be the best. Not necessarily.
Well, I happen to know who he went to. I think a lot of my friends in California know this doctor and have been to this doctor. But I fault him for not saying enough, for continuing to go back and go back. I mean, they say that at one time he went in and said, "Make me look like Diana Ross." That's the story. But why the bleaching to the point where you go from one shade of skin to a completely other shade of skin? And how do you do that? Is that done from outside? You can't take a pill for it, right?
So there's a whitening agent that's actually right now on the outs called hydroquinone that can be used to lighten the skin. There's things called kojic acid that can be used.
But you'd have to put it everywhere on your entire body.
You'd have to continually use it. But there are ways that you can block the melanin as well. It's unfortunate, you know, and his dermatologist is known too, and you know, it's just, you know, just because it's somebody on TV, so, you know, even the doctors on Botched have botched cases.
I'm sure.
You know,
I mean, it happens.
It happens.
But look at the jaw, the chin right there.
Yeah. He wanted a cleft.
Right.
Which is what most people want to go away from, but he added it. So if that's what made him happy, but it was just too much.
Oh, I think so.
Always.
Way too much.
And unfortunately, for some, money talks. And so people didn't want to turn. Listen, he went to sleep with IV anesthesia.
We know that story.
So unfortunately, people just don't say no.
I just want him to rest in peace. Do we have someone else we can look at?
Let's go ahead.
Oh, Priscilla Presley, who I know and love. She's a friend, and I adore her.
So, you know, first of all, the big story with her is that she went to Mexico and at one point was injected with who knows what.
Silicone, maybe?
We think silicone, but she had terrible infections afterwards, had to be removed. You know, her brow was lifted, and it's not terrible from where her brow was beforehand, you know, and then she's also using makeup to do that too. It's so hard to tell from her earlier makeup, but her eyelid, it's
she's still a beautiful lady and a sweet woman.
Yeah, I mean, the lip I would do a little bit different.
Well,
but if she's happy with it.
If she's happy, we're happy.
Yeah.
And the key is always moderation.
Yeah. Again, my whole thing with her is a smart lady, a wealthy lady goes to Mexico. You don't have to try.
That doesn't make sense. Before we leave, I just want to say, did you hear about the lady that died from the botched nose job in Mexico?
Yes.
That was a very sad story.
Yeah.
So if you're going to have surgery, do it here. Go to Dr. Berkowitz. You won't die, I promise you. And we'll be back next week with more tips for you.